So I thought that the Dolphin tank was fantastic. And I think as a disclaimer, I did not know that it was the first virtual Dolphin tank. So that was probably a good thing. And so really the process for me was I had identified a problem, which was that we have an increased number of behavioral health and substance abuse patients coming into our emergency department. So much though that it's having a significant impact on the experience and taking care of other patients. So I filled out the SBAR. So part of the Dolphin tank process, because we're smarter and friendlier, is to do an SBAR in advance, which I thought was very helpful. And so did the members of the panel, because now they had a pre-read, right? So everybody came to the Dolphin tank very well prepared. They had read the information up front. And then what the facilitator asked me to do was just give a quick overview. So I gave a Reader's Digest version of the SBAR, and then we started to dive into the questions. And so really the problem was that, as I indicated, we really are struggling with the significant increase in behavioral health patients coming to our emergency department. So much so that we either need to A, build an addition and or a separate behavioral health emergency department, or B, really consider another strategy. So I was very much going down the path that I thought that we wanted to spend the capital, build out in our emergency department, and help solve the problem that way. So I think what was really important about the Dolphin tank was the members who were on the panel. Some of them had experts in behavioral health, they had experts in other states, experts in behavioral health in other spaces, and it completely changed my mindset and direction. So that to me was the key value of the Dolphin tank. So instead of building out an emergency department, we are now going to preserve that multi-million dollars worth of capital that we could have utilized for that project and channel it into something else. And what I've been doing, and I have to say that I was very humbled by the positive feedback of my fellow Medvallistas when we had our follow-up conversation, was the amount of action that we've already mobilized with regard to this project. So what we are doing now is I'm taking the advice from one of the panelists, and we are partnering very closely with the behavioral health federally qualified facility in Newport County, and we're working on strategies, and we are already implementing a two basically chair detox program in the town next to us. And we're working with our EMS providers so that if patients are not in distress and they simply need to be detoxed, they can go to Newport County Mental Health versus our emergency department. So it's a pilot program, and we're hoping to grow those 2 beds to 4 beds, to 6 and incrementally, et cetera. So that's one strategy. The second strategy is we have a very large wet shelter on the island, which means that you can be an active alcoholic or drug abuser and you can still stay in the shelter, where many shelters have the requirement that you have to seek help. So this one does not. So the good news there is we've been able to mobilize basically 2 of my physicians, one that heads up behavior health and the CEO, the new CEO of Newport County Mental Health, to sit on their board. So now we have a voice at the table. The third track that we're exploring within that shelter is putting a primary care clinic there. So that way we can work on med management, making sure that there's well visits, if there's sick visits, to hopefully, again, keep people out of the emergency department. So those are the very 3 quick strategies that we've been able to implement. And without having the Dolphin tank, I would be actually going down the other path, trying to, do a schematic design, build out the emergency department. It would probably cost between 10 and $15 million. So far, I've spent $0. And the last thing that I'll add is we are exploring the addition of adding psychiatric nurse practitioners into our emergency department, which might seem like a simple solution, but it's more complex. And then lastly, I've asked Newport County Mental Health, and this was the big ask that I had, is to ensure that they have weekend hours. So one of the biggest challenges that we have is they're open Monday through Friday from 8 to 4:30, then they close down. So you can imagine at Monday by 9 a.m., I have 15 behavioral health holds because there's 0 weekend resources. So now they're putting a plan together to staff on the weekends and also to provide better consultative service to us and liaison between the patients that we share. So it was an outstanding experience. I gained a lot. It shifted my thinking, and we're being very action oriented, because at the end of the day, these patients deserve great care, and our goal is to get them really out of the situation they're there so they can be productive citizens. So That's my dolphin tank experience.